And for you, was the diagnosis, enough to say, okay, now I feel good, let's jump into treatment? And is that what you did?
Yes. So I looked for a lot of doctors here in the South that wanted to treat me with more than just like a week of antibiotics. And I couldn't find anybody that wanted to touch me. Nobody in Texas wanted to touch me. There was one guy here, but he had like an 8-month waiting list. And I'm like, I have lived sick for like a decade now. Right. And I don't want to do this anymore. So I went on, some like Lyme blogs and some Lyme forums. I'm like, hey, does anybody have a doctor? I'll fly wherever you want me to fly at this point, right? You have to make a commitment to your health. You have to choose your health. At this point, it's like, I knew I was dying. So it's like, I have to do something. So I found a doctor in DC, and I flew up and saw him every month. And he put me on an array of antibiotics. And he had also diagnosed me with Babesia and Bartonella at the time. And he started me on a ridiculous amount of antibiotics. And that went on for like 8 or 9 months until my body could not handle the antibiotic treatment anymore. He wanted to put in a PICC line. And again, my internal gut was like, absolutely not. We're not ready for that. And I told him, I go, I'm not ready for that. And he goes, it's time. You're not taking in the oral medication. It's not processing correctly. Like, we need to take it a step further. And I just refused. I'm like, I'm not ready for that. And he changed my medication. He's like, we're going to change it one more month. And he goes, if you're still not any better, we're going to proceed with the PICC line. And he changed my medication. And like, my body had a complete and total meltdown when he changed it. So after that, unbeknownst to me, my mom had actually made me an appointment with Innovative Medicine at that point, and she hadn't told me. And in the middle of this meltdown, my body is having a full-blown meltdown in the parking lot of my sister's like bridal gown shop. I'm supposed to be like shopping for wedding gowns for her wedding. And like, I couldn't even go in because I was so violently ill. And she's like, please go see this doctor. So I completely committed to Innovative Medicine, like sight unseen. I knew nothing about it. I was just like, okay, fine. Like, I'm in. So I did the DC doctor for 8 months. And then I waited for like 5 or 6 months to go to Innovative Medicine when my appointment was. And I haven't looked back since then.
Now, when you were how old were you when you started the antibiotics?
I was 30.
And I know you wrote here, you didn't think you were going to see 33, right?
I did not. When I had the meltdown, which was May of 2017, my body, it was shutting down at that point. Like, I knew at that point I was for sure dying. I was like, maybe I have a year left, like maybe a year and a half tops, to where I could like keep moving and keep operating. But I had gotten to the point during that summer where when I would come into contact with people that I didn't see all that often, I would think, like, make sure this is like a really great hug, because it may be the last hug that they give you and they receive from you. So make it like memorable and, like take it in and really, really feel that moment. But I knew that there was absolutely no way I could continue on the level I was moving. And I was just progressively getting worse and worse over the summer until I came to Innovative Medicine in October of 2017. So it was pretty tough.
Yeah. And that's the thing. A lot of times it's not to knock antibiotics. They have their place. But against something like Lyme, especially when it's been there for a long time, it can be incredibly hard, and it could be the road down into something worse. Because I've always said antibiotics are like nuclear bombs for your body. You're hoping you get rid of the bad things in it before all the good things, and you just shut down altogether.
Right.
It's a little bit like chemotherapy in a sense. People
Yes.
don't realize that when they pop those pills, but antibiotics literally means anti-life. It kills everything inside you, good, bad. It does not discriminate.